is likely due to the circulation of a new variant, the BA2 Omicron subvariant. The Omicron subvariant BA2 is reportedly more transmissible than the BA1 by approximately 50 to 80% and has been contributed to the global transmission of COVID-19 in the past 2 to 3 weeks. As a responsible ministry, we will continue to monitor the scientific data and make the appropriate interventions to manage this public health situation. We are not going to reverse any of the measures that we have implemented because there is no need to, and therefore no curfew and no lockdowns are necessary. I take this opportunity to remind Barbadians that we are still in the COVID environment, and although infections will increase, there is no need for excessive concern. The core of our battle remains personal responsibility, which continues to be the key in maintaining control of the COVID situation and reducing the positivity rates. We are aware of the concerns regarding face masks, but masks are still highly recommended and effective in reducing the impact of COVID. The Ministry of Health and Wellness, through its Health Promotion Officer and volunteers, will be increasing the distribution of masks in the community. Concerns have been raised about the continued use of prosecutions and the court system to deal with what some consider to be relatively minor breaches of the COVID directive. Other jurisdictions have been using ticketing systems as a quick and effective means of punishing individuals who break the rules. We will therefore discuss with the Attorney General how a ticketing system could be implemented in Barbados to deal with such things as the failure to wear masks in a public space and other similar breaches. Vaccinations and boosting are still the most effective prevention strategies to prevent against severe illness, hospitalization, and death. Based on the data and other factors I have presented, we do not regard this new situation as a setback. Rather, the possibility of such an occurrence has been long anticipated and planned for, given that such events are a natural part of the internal behavior of viruses. As I've said before, all indications are that we will have to continue to live, work, and socialize safely in this COVID-19 environment, closely following the established and proven protocols. On the other hand, I wish to call on Barbadians to continue the large-scale cooperation and observance of the protocols that have allowed us to move to the point where we have begun to open up the country and economy even further. Thank you.
Thank you very much, Minister. We'll go to Dr. Best.
Thank you, Ms. Lorde. Good evening to all in Barbados. I'm honored and happy to have this opportunity to be part of the team, the distinguished panel here tonight, to give you an update on the situation where COVID is concerned in Barbados. Let me thank the Honorable Minister for setting the stage, making my job easier in terms of talking about the statistical situation and providing some of the public health context in which we operate. I believe, however, it is still important for me to repeat and to re-emphasize some of the data that Minister Gooding-Edghill would have mentioned. So we're here today because we noticed a dramatic increase in the total number of cases reported in today's dashboard for Monday. That represented a near 100% increase over the previous day, where we saw 222 new cases. This increase, however, did start around the 28th of May. In the last 8 days, we've diagnosed approximately 2,000 infections, and the reproductive number is 1.5, which simply means that one infected case can lead to 1.5 cases, or 2 persons who are infected can lead to 3. So it is growing. And when the R effective is 1.0, or rather when it is less than 1.0, it is when you have control of the outbreak and it cannot grow. The Minister would have also mentioned that the doubling rate is approximately 3 to 4.5 days. Once again, these are all indicators signaling that there is growth of the epidemic. Positivity rate over the last 7 days is 22%, and the daily average of new cases is 245. The number of admissions seen at the Harrison's Point facility has increased significantly, and we have Dr. Corey Forde here to talk a little bit about that in terms of the numbers and in terms of the clinical features of patients who are presenting for the management of COVID-19. In terms of the vaccine program, at this current juncture, 56% of the total population is fully vaccinated against COVID-19. When we looked at those who are eligible to be boosted, so meaning those who have gone past the 6-month mark after having their primary series completed, we're only at 45% of the eligible population being boosted. So we need to get those numbers up. Persons need to come forward to be vaccinated against COVID, and persons need to be boosted if you've been fully vaccinated and you've gone past 6 months since the final dose in the primary series. Since January of this year, we knew that our epidemic was being driven by Omicron, a more transmissible yet milder variant of COVID, and this is in keeping with what we were seeing globally. We are preparing to send samples to the CARFA labs in Trinidad for genomic testing to determine if the BA.2 subvariant of COVID is at play, but we can reasonably assume that BA.2 subvariant is here and is circulating in Barbados. The Omicron variant is the most dominant variant circulating globally, and the BA.2 variant has been taken over in the last 4 to 6 weeks. It is a subvariant of COVID, not a distinct variant from, it's a subvariant of Omicron. It is not a distinct variant of concern. And as the minister would have mentioned, it is far more transmissible than the initial sublineage variant, which is the BA.1. So in terms of prevention, we need to protect ourselves and our loved ones from COVID-19. So let me just repeat some of the strategies which we all know, but it is worthwhile repeating what some of those measures are. So the wearing of masks is important. Physical distancing, hand hygiene must be good, whether it is due to the use of alcohol-based hand sanitizer or the use of soap and water, and ventilation. We also have COVID vaccines, which I would have touched on just now. So for those persons who are not yet vaccinated, please come forward and get vaccinated. And for those persons who have been fully vaccinated and are due boosters, please come forward to be boosted against COVID-19. COVID-19 testing continues. We provide at the public sites, we have the Eunice Gibson Polyclinic, the Bradford Tate Polyclinic. We also have the Garfield Sober Gymnasium testing site and the Queen's Park Steel Shed testing site as the sites that offer routine testing for persons who require testing for COVID, whether it is that you've had contact with somebody who is diagnosed with COVID or whether you have symptoms of COVID. And of course, testing at those sites are free. But then there's also in the private sector, you can also pay for a test, a COVID test. Of course, we continue to isolate persons who have COVID-19, and we have facility-based isolation at the Harrison's Point facility, but we also have home isolation, which is the lion's share of isolation. And we have Dr. Adanna Grandison to talk a little bit about that this evening. We continue to do surveillance at our ports of entry, which essentially means that we have protocols in place for persons who are traveling into Barbados. And those protocols entail persons being tested prior to coming, and there's quarantine that is required for persons who are unvaccinated. And of course, we have a whole host of other prevention strategies, such as the community outreach efforts that were mentioned just a few minutes ago. So March of 2022 made it 2 years that we've had COVID-19 in Barbados. We've accrued a tremendous amount of experience and knowledge from this pandemic. We've been through the worst, but now we need to learn to live with COVID safely. This is not a setback, as the minister would have said, but this current situation requires all of us in Barbados to do our part. So I want to thank you for the opportunity for being here, and I look forward to the questions that are going to come later. Thank you, Ms. Lorde.
Thank you very much, Dr. Best. We now go to Dr. Forde.
Good evening, Barbadians. It's a great pleasure to be here with you again. I'm going to give you a brief update on what's going on in isolation. But before I even begin, in the words of our Honorable Prime Minister, Mayor Motley, this certainly is not a sprint, but certainly it's like a marathon. And for most of you, knowing a marathon at points, you need to stop and get a little bit of water. And that's probably where we are right now. But I think despite all you've heard today, you need to be encouraged and just follow what needs to be done. All of you who are listening today have heard all the key aspects that you're required to know to stop or to prevent COVID transmission. In our isolation facilities, at present, we have 75 individuals. There are 23 males and 52 females at the facility. I think it's important to note within that number that 10 of them are in our primary isolation A building, which is where we have our most ill people. And of that lot, we have a total of 7 who are actually on some sort of ventilator therapy or oxygen therapy. I think if we look at the presentations of individuals, and over the last few days, as Dr. Anton Best has said, we've seen certainly an increase in number of individuals over the last 7 days. Our admission numbers have increased almost 50%. But I think what is in those numbers is important and can help you as you listen on today. So as we look at the majority of those admissions over this period of time, the majority of those individuals that I mentioned are actually people who are asthmatic and have gotten asthmatic attacks in the presence of COVID. And it's with that I would like to encourage all of those certainly who are in the community who are asthmatics and who have symptoms of COVID or have COVID to present themselves very early to our system. What does that mean? And to just spell it out for you very clearly. If you feel unwell and you have COVID, I'm asking you to present yourself through the operations center to our assessment centers. Those 2 assessment centers still remain at the 4-H facility in Belleville and the facility at the Barbados Workers Union College in St. Philip. You can present yourself through the operations center for assessment. And I'm really encouraging, because people, from what we're seeing, especially some of the younger ones, are presenting to the facility a bit late after 4 or 5 days of symptoms. And then obviously that's a struggle for us. I think that if you present early, it puts yourself in a better position to do better. So I want to first encourage you in that. I want to talk to Barbadians today on the last point when it comes to isolation. And that really is to those people who are in households of elderly people. And there I go again. One of the things I'm continuing to see, which I'm very unhappy with, is the elderly persons who are presented who are unvaccinated. If you have old granny, grandfather, your grandma, your neighbor next door, you know they're not vaccinated, try to get them vaccinated. And if they've been vaccinated and they had their 2 shots, make sure that they go and get boosted. I think all of these things, apart from all the other measures that have been mentioned by the Honorable Minister and the Chief Medical Officer, if all of these things are put into focus in this country, we'll be able to deal with this. We as Barbadians have dealt with this before, and we're currently dealing with the situation again. And I want to encourage you to just follow those particular lines of things which you as the average Barbadians know for sure can pull this back. Wear your mask, use the appropriate hand hygiene, distance when appropriate, and be cordial. If you're ill and you feel unwell, present yourself to the system. We're there to take care of you and to get you back home with your families. Ultimately, that is our major goal, whether it's at the assessment centers or whether it be at isolation facilities, and certainly for the home isolation thing. Thank you.
Thank you very much, Dr. Forde. Now, as we open for questions, so far we have Shane Jones from CBC and Colvin Mounsey joining us. Colvin and Shane.
Yes, hi, good night. One quick question for the Chief Medical Officer. In terms of, sorry, are you hearing me?
Yes, we are.
Yes. In terms of the BA2 variant, given that that's a subvariant, what are the chances of reinfection at this point in time for persons that would have already contacted the BA1, the BA1 variant? What are the chances for reinfection?
So just a few weeks ago, the WHO would have explained that the chances of reinfection with BA2 subvariant, if you've had BA1, is very low. There's not a high likelihood of reinfection if you're looking at the Omicron variant. However, there is the possibility of reinfection if you're looking at Omicron compared to a previous variant such as the Delta variant. I would also like Dr. Corey Forde to respond to that question.
Thank you, Dr. Best. I'm just going to reiterate what he's basically said, that yes, there's a risk for infection, and certainly there are people who we have seen in isolation facility who's had Delta before or Alpha. we probably can't even remember Alpha at this point. That's so long ago, it feels like. It is not that long ago, and you can have those persons be affected. And we certainly have seen cases of persons who we've seen before in the isolation facility who have certainly returned.
Colville, did you have a follow-up? We're not hearing you.
Yes, sorry, I said no follow-up at this point.
Okay. Shane?
Hi, Shane Jones, CBC News. Dr. Best, you were identifying that we were somewhat in a surge, a spike of some sorts. Normally, when we have a surge or a spike, there are some sort of projections given about how long it would last and what number of cases we would have. At this point, is there any indication of what this surge would look like for Barbadians when we would come out of it?
So Shane,
how big it would get?
Yeah, so Shane, that's a great question. You're absolutely correct. Prior to the Delta, in fact, prior to all previous waves, we had projections done so we can get an idea as to how large this outbreak was going to be, because it was important for policy and important for programming. We did that for Omicron, but we have not done that for this subvariant BA2. So this is something I will certainly discuss with colleagues if it is something that is required. And if it is required and necessary, we will do the estimates and projections that are required, and we will make those results public once we've gone through the correct channels. So thank you very much for that question.
And Shane, did you have a follow-up as well?
All right. Quick follow-up to the subvariant. That's what you called it, right? A subvariant. Because you said it's a subvariant, it's not one on its own. What does that, if you can drill down a little deeper, because you went past that a little quickly for us, what does that really mean for Barbados and Barbadians and what we are facing at the moment as the subvariant? How should Barbadians, I know we always should take everything seriously, but what should Barbadians be preparing for with the subvariant? Drill it down a little deeper for us, please.
Shane, I'm going to be a little cheeky and respond and say that I went past it quickly for a reason. Because my knowledge on this is extremely limited, and you have to appreciate that the knowledge in the scientific community is also somewhat limited on this, but we are learning quite a bit every single day. So whereas when we had the Delta, and the Delta wave in Barbados would have started around August of 2021, and we were first alerted about Omicron towards the end of November, if I remember correctly, we are not right now seeing any new variants of concerns or variants of interest in the same way that we did ahead of Omicron. So now that Omicron is here, what we are seeing within Omicron is a subvariant. In other words, at a genetic level, at a microbiological level, it is not that distinct. The BA2 variant is not that distinct from BA1. So that is why it is not a separate variant of concern. The same way as when we transition from Alpha to Delta or from Delta to Omicron.
And I understand now that we have Barry Allen as well from Nation News. Barry, good evening.
Hi, good evening, Lisa. Thank you. A quick question for Dr. Best. Dr. Best, you would have said it's reasonable to deduce that the BA.2 subvariant is probably within our population, but the question I have is there a particular reason why the sequence sampling results from CARFA are not with us officially yet? The last time the CMO would have held a press conference, he said it was expected that, the system would send those samples to Trinidad as a matter of course, and pretty quickly, but you said today it's reasonable to deduce, which implies that you don't have the results back yet.
Yeah.
When do you expect those results to be back?
So Barry, you're absolutely correct. For the last couple of weeks, we have been talking about it and planning, but we do have some real logistical issues in terms of sending the samples. The testing is not being done in Barbados. It's being done through the CARFA labs in Trinidad and Tobago. So we anticipate that by Thursday, we would send off the samples. The turnaround time that they normally tell us could be as long as 2 weeks. If we are lucky, we would get those results back in a week. We have done some preliminary or initial screening of samples in Barbados.
There's a particular test that we have that can rule in the Omicron, but it cannot tell you if it's BA1 versus BA2. So right now, those preliminary tests done at the public health labs are saying, well, this is definitely still Omicron. But we believe, based on the patterns, based on what we're seeing, that we are having BA2 because there's now spread. And for all intents and purposes, all of the other measures are remaining in place and behaviors haven't changed significantly to explain an explosion of cases. Ms. Lorde, sorry, if I may, Barry, are you finished? Because it was part of Mr. Jones'
I just had one quick follow-up.
Okay.
When you look at the numbers, how they have exponentially spread in the last, let's say, 10 to 14 days. I remember Dr. George also saying last week that COVID is so prevalent, it's actually widespread. But now that we are seeing these large numbers, are there any particular clusters of concern, or is it still very widespread across the entire Barbadian population?
So for the last almost 12 months, we have not been doing contact tracing. We still do pay attention to particular clusters. So yes, we do have clusters within institutions. I'm not at liberty to say which institutions at this point, but suffice to say that it's nothing different from what we've been seeing over the last few weeks and last few months. So nothing new and out of the ordinary in terms of where the Omicron outbreaks, the current outbreaks are occurring.
Dr. Best, given that the efficacy of even booster shots at this point have begun to wane at this point, is there any thought at this point to change in the definition of fully vaccinated?
Yeah, so we have had discussions about changing the definition of fully vaccinated, but we don't have a conclusion as yet from the Ministry of Health. But as soon as we do, as soon as we have made a decision whether or not we're going to change the definition of who is considered fully vaccinated, we will let you know. But please appreciate that even in the absence of a changed definition of fully vaccinated, we are pushing the vaccines for boosters, and we are monitoring the uptake of the booster campaign as well.
This is a question for Dr. Forde. Normally, when we get stats on COVID-19 and the dashboard, we normally only see the vaccine status of someone who has passed and who's unfortunately passed. It would be helpful to know, these are stats that you would probably have, the people who are indeed testing positive for COVID-19, what's the ratio with the people who are unvaccinated to those who are vaccinated, just so we understand how this is working and how the vaccines are working? Because we know obviously the vaccine does not prevent you from getting COVID-19, but for those who are actually presenting and actually coming to get tested.
Yeah, so thank you, Shane, for that question. And I anticipated this question, actually, to be frankly honest. Right, so if we look at it, and I think the most important thing for most Barbadians to understand is the persons who we're more concerned about. Certainly you see the number of cases increasing, but I think you need to look at the other leg, and I'm going to answer your question in the end. We need to look at the other leg. It's not generally only about increasing number of cases. You're looking at increasing number of cases, and what cripples countries is the impact it has on the healthcare system. So if the number of cases are increasing, but your impact on your healthcare system is less, then that's practically fine. And that really comes to the fact that if people are actually vaccinated on the ground and they are properly boosted, then in terms of impacting the healthcare system, in terms of people being extremely ill, one often doesn't see that. If we look in our primary isolation A, for example, it really paints the picture. So in our primary isolation area, which is the area we have the most sick people with on ventilators, etc., that proportion there is very clear. So one sees at least out of the 10 individuals, there are only 2 individuals in there who are actually vaccinated. The others are all unvaccinated individuals. And that number might change because we had admissions today to that unit. But generally, that's what one generally sees. In our secondary isolation, where people are less ill or actually recovering or actually presented, the picture is a bit different. So we have almost a 50-50 percentage within that area. But I think it's critical to mention in that area that people actually get better and actually will often go back home to their families. And the point that you've made, I think, was a very intelligent statement at the start, which is to basically say, look, being vaccinated does not prevent you from getting COVID, but it actually helps you in terms of preventing you from ending up in the most sickest area of the facility, which is our primary isolation A. And I think that's what the average Barbadian needs to understand. I'm going to say it again, and as I said it before, and this time I'll say even more passionately, we need to go back and look at our vaccination rates and deal with that. And the average Barbadian needs to understand this is why people see countries across the globe, including the US and the UK, etc. And we're seeing people say, oh, don't wear a mask anymore. But look and see what their vaccination rates are. They're far better than ours. And this is why those decisions are being made. We have to put ourselves in that position to do that. The impact of being vaccinated impacts everything. I'm genuine. I think that a lot of focus needs to be placed on that, and people need to be appropriately boosted, and we need to take care, say it again, we need to take care of our elderly population and to make sure they're vaccinated. When they come into isolation, those who are unvaccinated often come extremely ill, and we've done well, and we've got home 100-year-olds, we've got home 90-year-olds, but I think we can do better to help that population. We cannot leave them and their families need to really get them out and be vaccinated at this particular point as we see these increasing number of cases. Thanks, Shane.
Well, colleagues in the media, I crave your indulgence. Dr. Grandison wants to come in here to give an update on the home quarantine program. Dr. Grandison.
Good evening, Barbados, and thank you very much, Lisa. Yes, we do have now, as of currently, we do have just over 2,000 persons in home isolation at this point in time. And I cannot disagree with anything that Dr. Forde, certainly, or even Dr. Bess has stated. But I would go even a step further. I know a lot of persons say, well, I'm not going to get vaccinated simply because if I get infected, if I get sick, I'll get better. I'm relatively healthy. But it's not just acute COVID that we're thinking about. It's also the quality of life, possibly with the development of long COVID. And so in terms of wanting to have a better quality of life, this vaccine is not only helping you in terms of mitigating severe disease for the acute illness, but also decreasing the chances of you possibly developing the complications associated with long COVID. So far, in our home isolation program, we continue to have the predominant number of persons being in green. However, we are noticing an increasing amount of persons becoming yellow. And I think that, as Dr. Forde would have stated, is absolutely important that, especially for those asthmatics, I would have stated it this morning, but I will continue to rehash it and say it again. For those asthmatics, if you know, even if you have not wheezed recently, please go out, get your inhaler prior to you testing. And I want to say also something about testing. We have been noticing a lot of persons using a home test. And I know you want to know your status, but it's absolutely important so that we can expedite you through the system so that you get the care that you need to go out and get an official test. And when I say an official test, I'm referring to the official PCR test. Remember that the rapid test is predominantly for that person who's symptomatic. The PCR test, we will know definitively if you're positive or if you're negative. We want to encourage you to get that PCR test, because once you are PCR positive and you become ill, even if it is with minor symptom or more severe symptom, we can expedite your care as quickly as possible. It wouldn't be a situation where you would have to go, for instance, to one of our tertiary facilities and sit down for an extended period of time. You would be able to essentially go to a center that is dedicated for you, and that's what we really want to ensure, that persons get the care that they need as quickly as possible.
Thank you very much, Dr. Grandison. Are there any further questions?
Yes, Lisa, just to finish off, a question for Dr. Bess. Dr. Bess, at the last press conference, Dr. Arthur Phillips would have spoken to a very small percentage of school infections. Now that we're seeing this exponential increase in cases, can you speak to the level of infection within our schools? We do have most of the education system back in face-to-face classes, and I would expect these schools to be a microcosm of our society, and we would have some infections. Does it concern the Ministry of Health and Wellness at this stage?
So Barry, that is a great comment that you made in terms of recognizing that the schools are a microcosm of what is happening in the community. You're absolutely correct. So we have analyzed the data from the 21st of February when the schools resumed face-to-face classes. And I'm not at liberty to say what that information is. We simply don't have the clearances yet. But the number is relatively small when you take into consideration what is happening in the community. So this is what we anticipated. We did anticipate that we would pick up a few cases in the schools, but we're not seeing sustained transmission happening within the schools because the protocols are working. So far, the discussion in the Ministry of Health is that even in the face of an increase in the number of cases in the community, there is absolutely no reason parents need to be concerned, teachers and non-academic staff at our academic institutions do not need to be concerned about what is happening in the community in terms of outbreaks occurring within the schools. Yes, it may mean that the number of cases in the schools may go up simply because the schools are nested within the communities, but the protocols are working, and the recommendations that we've made to the policymakers is that everything needs to remain as is for the time being. There's absolutely no reason to change direction at this point in time.
Colville?
Dr. Best,
Yes.
Sorry, Shane.
Go ahead,
I think
Shane.
Colville was next.
Thanks, Mosey.
Okay.
Dr. Best, one final question from me. I noticed that you said the increase started from March 28th. I was thinking that date sounded a little familiar when I checked back. That was just probably about exactly a week after the test match, West Indies versus England. So I know you said that you haven't been contact tracing, but have you made any link between the start of the increase and the test cricket that we had here at Kensington Oval?
Shane, boy, you want to get me in trouble this evening. So when we said that there is an increase, and the increase was around the 28th of March, I should have explained that we did something in epidemiology called aberration techniques to determine when the increase was likely to have started. So anywhere around the 28th, it would have started. We have not made a link to any of the events, any of the circumstances in Barbados. It is reasonable to assume that there may be some contribution from different events, but that's an assumption so far. It is not a hypothesis that we have taken into consideration and have studied. And in terms of contact tracing is nothing that we currently do. We have not been doing routine contact tracing for quite some time, and we have no evidence to suggest that there is a link between the increase in the cases and the cricket that you would have mentioned. But thanks for the question. It was a great question.
Colville, the final question is yours.
Okay, a quick question for Dr. Grandison. You would have mentioned that a number of persons are transitioning into yellow. Could you just give me some percentages, if you have that to hand, please? And what are the conditions of those persons that normally transition to yellow? Are they just asthmatics only? When you say transition to yellow, are you also persons presenting with renal issues, as would have been with the American BA1 as well? Just some quick stats would be nice.
Great question, Colville. So right now we have 503 yellow persons out of our cohort of persons that are in home isolation. However, I will definitely tell you that a person with renal failure or renal impairment to the point where we are concerned certainly will not be remaining in home isolation. So they would not be a yellow. That's some person that would be going on to get care at a tertiary facility. The persons that are in the yellow category are essentially your persons who are having vomiting, diarrhea. They continue to have dehydrational losses, and certainly going on to have respiratory type symptoms. So these are the persons that we're saying we're very concerned about at this point in time. We want to monitor you a little closer. There is also the group of persons who certainly have those risk factors. I know we have sort of put away the risk factors in a closet of recent, and we haven't really spoken about them, but because we are seeing a lot of persons not paying a lot of attention to their NCDs at this point in time, it is certainly becoming a problem. Those risk factors are no longer as controlled as they were before, because persons are not being very mindful and managing their hypertension well or their diabetes well. Certainly our activity is not as much as it used to be. These are serious concerns that we continue to have. And so those are the persons that would go into that yellow category, and then those are the persons that we would recommend certainly to go and have an assessment in person, because we want to get persons into the assessment centers. If they remain in that category after 24-hour period, certainly those are the persons that we then send for assessment. So at this point in time, 503 is your answer.
And as we head up to news time, Minister, I'll give you closing comments.
Thank you, Lisa, and thank you, listeners. I want to reiterate what I said earlier and what other members on this panel would have said. The issue continues to be vaccination and boosting. Both remain the most effective way of managing the current COVID situation. I encourage all of you who have not yet been boosted to do so, and those of you who probably haven't completed your full dosage of vaccination, that you should do so. It is important that you do this because it is critical to us managing our public health institutions. It's also critical in cases of severe illness and certainly hospitalization, and obviously to prevent deaths. So we want to encourage you to go there and to get vaccinated and to get boosted. The other thing I would like to encourage you to do is to continue to exercise the discipline that you've done from the inception of the COVID pandemic in Barbados. You've maintained that discipline, and like I said, it's helped us to get to the point where we are today. And once you continue to wear your mask, practice all the hand sanitization techniques and all that the necessary sanitization methods, I think it will get us and stay us through this particular COVID situation. There's nothing to be alarmed about. As I said earlier, there's no need for excessive concern. We will continue to manage it. We have plans in place to manage the situation in the event that the numbers should increase, and we will continue to do our best to manage all public health institutions in your very best interests. So I thank you, and once again, stay safe and remember to practice all of the sanitization methods and protocols that we've put in place. Thank you, Ms. Lorde.
Thank you very much, Minister. That was the Minister of Health and Wellness, the Honorable Ian Gooding-Edghill. Let me also thank Dr. Anton Best, the Deputy Chief Medical Officer, the Head of Isolation Facilities and Infectious Disease Specialist, Dr. the Most Honorable Corey Forde, Consultant Manager of Home Quarantine, Dr. Adanna Grandison, members of the media, and you for joining. Good evening.